All right, we ready?
Yes.
Okay, we're gonna read. This next section is pretty quick. It's the parathyroid disorders. It truly is really quick. I'm just gonna give you an overview, okay? And we've talked a little bit about this during the thyroid lecture. So that's the thyroid gland. Remember our butterfly-shaped thyroid gland, and we have those cute little parathyroid glands that are nestled in there really cutely, right? Those yellow thyroid glands. They are not attached. They look like they're attached, and they are nestled in really, really close, but they are separate. Okay, they're separate entities. So this is the parathyroid. Okay, we have 4 of them. What do you think the parathyroid glands secrete? PTH, parathyroid hormone. When I talk parathyroid, when you guys think about parathyroid, I want you guys to think about calcium. Here comes this calcium article that we talked about coming back in, okay, or that you guys should have read, right? Okay. If you didn't read it, go read it, please. Okay, it really is a quick read. We just need to understand the relationship between calcium and phosphorus. Okay, that's what you're wanting to get out of it. And you might understand that by the end of today's lecture, but go ahead and read it, make sure we solidify that for you, okay? So, parathyroid glands, they're gonna work with vitamin D and calcitonin to maintain a calcium balance. Okay? So just know, we have to have the parathyroid hormones in order for calcium balance to be maintained. Okay, there's a lot of information there, but that's kind of what that boils down to. Okay, so some of the jobs of the parathyroid hormone is to stimulate osteoclast activity. So that is moving the calcium from the bone into the blood as we need it. Okay, remember, this is a feedback loop as well. Okay, so when we need it, it does it. It promotes reabsorption of the calcium in the renal tubules and the GI tract into the blood. So whatever the kidneys would have been excreting, it gets pulled back into the bloodstream as we need it. It promotes phosphate excretion in the kidneys, so to get rid of the phosphate. And this is going to all be stimulated by minute changes in the serum calcium. Okay? So you can think of the thyroid and the parathyroid like a thermostat that regulates temperature. If you guys know how that kind of loop works, you can kind of liken it to that a little bit. So the parathyroid is constantly monitoring the amount of calcium, and it's going to adjust how much parathyroid is hormone that it's spitting out based upon that feedback loop. So parathyroid hormones, then calcium. Okay, so parathyroid disorders, again, we have hyperparathyroidism and we have hypoparathyroidism. When we think hyper, we're going to think high, right? So hyperparathyroidism, we're going to have a higher serum calcium, okay? If they have hypoparathyroidism, if hypoparathyroidism, we're going to see a lower serum calcium. So the parathyroid hormone increases the calcium serum levels. What is the relationship between calcium and phosphorus?
Inverse.
They're inverse, right? They're opposites. So if I have hyperparathyroidism, that means my calcium is high. What does that mean about my phosphorus is low? Very good. Okay. So hyperparathyroidism, so oversecretion of the parathyroid hormones, these patients are going to probably have a higher calcium level, right? So there's 3 different types. There's primary, secondary, tertiary. Don't need to know the difference. Just know that there are different types of hyperparathyroidism. Okay? And this could happen because of a parathyroid tumor. It could be the body's response in trying to compensate for a low intake of calcium in the diet. There could be an issue within that feedback loop somewhere. Okay, so again, the parathyroid hormone regulates calcium and our phosphorus levels. If we have an increase in the parathyroid hormone, we're gonna see an increase in the calcium levels and thus a decrease in the phosphorus levels. Okay, so this can go on for a really long time. Like a patient could have hyperparathyroidism for a really long time before it's even detected. And it can cause issues over time, which then will lead to us finding out that they have hyperparathyroidism. So sometimes we might see a patient on their labs may have an elevated calcium level, and it's just very slightly elevated. And so we kind of say, it's just slight, maybe that's just their normal. And then maybe the patient ends up breaking a bone or something, and then we get more depth into it and find out that they have hyperparathyroidism. Okay, they may have cardiac issues over time, hypertension, bone resorption, mental clarity might be off. So our brains really don't like a low or high level of calcium. They like it to be a normal level of calcium. We kind of get some mental clarity issues, difficulty with sleep. So patients may exhibit these symptoms, and they're not relating it to this parathyroid, to hyperparathyroidism. So imagine having a higher level of serum calcium, what that might turn into, right? Osteoporosis, they may have fractures, kidney stones may occur because of that. Because that parathyroid hormone causes calcium to come out of the bone and into the bloodstream. So if it's not in the bone, we might see these osteoporosis and fractures, right? Kidney stones, because we have increased calcium. Muscle weakness. What is the normal level of calcium?
Depends on where you read it. 9 to 11.
9 to 11.
9 to 11.
Call 911. That's how I remember it. Call, I know it's one out. 911. So, calcium 9 to 11. Phosphorus. I learned a new way. Does anybody know the phosphorus levels?
It's 2.4 to 4.4.
Yeah, it's just that. Okay, well, and it depends, again, the hospital that you're at, the facility at, you guys have seen this, it kind of varies, but if it's way off, you guys should be able to notice it, okay? So phosphorus, for those of you that don't know this, okay, so I'm gonna spell out phosphorus over here. Forgive my handwriting. Okay, so I have phosphorus written up here, okay? So I wrote down how to do this, so I just looked this up today. Okay, so pH, or there's the word 4 in here. So the number 4, okay? And then when there's an us, like there's an us, like 2 people get married as an us, that's 2 people. Okay? So that makes you go, okay, it's 2 to 4. But when us adds to the family, they add half of one of them and half of the other one. I know this is a stretch, guys, but it does sound correct. 2.5 to 4.5. Does that make sense? So phosphorus, there's the 4. For us, there's 2. There's 2 of us. And then when us gets together and we give half of ourselves and half of ourselves, 2.5 to 4.5. Y'all, I remember potassium by 3.5 to 5 bananas. So take that for what it's worth. Okay. So you won't have to know that for this test. I just thought it was fun. Phosphorus is one I could never remember, and then I looked that up today, and I'm like, I can do that. I can get on board with that. Okay. So remember that calcium plays a role in the electricity of the whole body. Okay. So we're going to be concerned about cardiac changes. It can cause hardening of the vessels, which could increase our risk for what? Stroke and increased blood pressure. Okay, so all of that can be caused by hyperparathyroidism. Okay, so to diagnose this, we can have high parathyroid hormone levels. Okay, high serum calcium. So serum calcium around the 9s, 9 to 11. Phosphorus around the 3s, so 2.5 to 4.5. They can do bone density measurements, and also MRI, CT, and ultrasound to detect tumors. There is a note that if it is cancer that's causing this, then the lab values might not match what we would expect for someone with hyperparathyroidism. Okay, and then think of the systemic organ damage that is happening when you have a higher serum calcium. the renal issues that it can cause, like we talked about, the hypertension and the risk for stroke and all of those things going up as well. Okay, so what can we do for these patients? So we can do surgery. So they can go and they can partially remove all of the parathyroid glands, or they can just remove one or two. Okay, they can do this endoscopically on an outpatient basis. So we can take 1 to 4, all of them, whatever. So this is really, I don't know, this is sci-fi to me. This is crazy. Okay, so if all 4 glands have hyperplasia, they're all doing too good of a job. They're all spitting out too much parathyroid hormone. They can go in and they can take them all out, and then they can cut them into like 1 to 2 millimeter pieces, and they can do what's called an auto implantation into a muscle, so like the arm or the chest wall. And it takes a little bit, I don't know the exact amount of time, but they can actually regenerate, grow a blood supply, and will start to work, like within a month or 2. Isn't that weird? Y'all are looking at me so stone-faced. That's weird, guys. That's cool. Okay, y'all, come on. That's cool. I think that's crazy. Human bodies are incredible, and the things that we've discovered that we can do with them is wild as well. Okay, so if all 4 are removed, auto transplantation fails, so that, or auto transplantation fails. Yeah. What are these patients going to need? What does the parathyroid regulate? Calcium. So if we take out all their parathyroids, we try this crazy sci-fi thing that actually works, which is crazy to me, and that doesn't work. And so this patient now does not have the parathyroid glands to secrete the parathyroid hormone, which regulates calcium. What might we have to give these patients? Calcium. Okay, they're going to be on a calcium supplement. And it's really, really difficult to keep a good serum calcium level on a supplement, but that may be what we have to do. Okay, so you guys know what bisphosphonates are? For like osteoporosis patients. So these patients might be on bisphosphonates, oral phosphates, okay, calcium mimetics. So calcium mimetics, they pretend, they mime that they are calcium. So it tricks the parathyroid into thinking that the calcium levels are good, so it's not going to pull that out of the bones. It also reduces the parathyroid hormone from secreting. Okay. And we're going to have diuretics to increase urinary secretion. Okay, so these are for patients that aren't a surgical candidate, but they have that hyperparathyroidism. They're splitting out too much of that parathyroid hormone. Okay, so post-operatively, all the things that we were concerned about when we do a thyroid surgery, if we're taking that thyroid out, thyroidectomy, we're going to be concerned about with these patients as well. Okay, so we're going to worry about their calcium levels if they develop tetany. Do you guys remember what tetany is? I think I mentioned it a couple weeks ago. It's like circumfleral tingling. They'll feel tingling on their toes and their fingers, indicating that they don't have enough calcium. So tetany is associated with not enough calcium. We're going to monitor their eyes and nose. Obviously, we're going to be looking at those electrolyte levels. Talking to them about their meals that they're having. So they had hyperparathyroidism. We did a surgery, so now they may go the opposite direction, so they don't have enough calcium. Okay, so talk to them about consuming enough calcium. And again, moving their body to minimize bone loss. Weight-bearing exercises are good for these patients. Important for them to be continuing to follow up with their primary care provider, and then teach them what are the signs and symptoms of hypocalcemia. Okay, that was hyperparathyroidism. Now we're going the opposite direction. Okay, you guys know hyperparathyroidism. You know what the parathyroid does. We're going the opposite direction. So not enough circulating parathyroid hormone. Do you guys need a second?
Yes.
Okay, let's take a break. We've got 6 more slides left.